Hello, my name is Kelly Reynolds, and I'm a professor and chair of the Community Environment and Policy Department at the Zuckerman College of Public Health at the University of Arizona. And my expertise is drinking water quality, risks, and treatment, and that's what we'll be talking about in today's webinar. Now, a question that I get a lot is our water in the United States safe for public consumption? And the first thing I ask people is, well, how do you define safe? And I can tell you the way the Environmental Protection Agency defines safe water is in terms of acceptable risk. So we clean water enough so that it meets the following criteria: that there are no more than 1 in 10,000 probability of infections per year based on the concentration of microbes that might be found in the water that can make people sick, and no more than a probability of 1 in a million cases of cancer per person per lifetime if they drink that water. So the next question is our water meeting those acceptable risk standards? The standards that I've been talking about are our national drinking water regulations, and these are standards that are either mandated by or suggested by the Environmental Protection Agency as the regulatory oversight agency. So there's two primary categories of regulations that we have: the national primary drinking water regulations and the national secondary drinking water regulations. Now, primary regulations are mandated. They are required by public water systems to actually follow, and they're health-related regulations for over 90 drinking water contaminants that range from microbial organisms, disinfectants, disinfectant byproducts, and these inorganic or organic chemicals and radionuclides. Secondary regulations are not necessarily related to health outcomes. They're the type of contaminants that affect the taste, the color, and the smell of the water. Water systems are not required to follow these guidelines, but they tend to want to because it makes the water taste, look, and smell better. But these are not contaminants, again, that are necessarily harmful to public health. They're just what we call aesthetic controls. And we have a lot of regulations to protect and improve and monitor our drinking water that public water utilities must adhere to. And in this table, you see some of the regulations that were set forth by the US EPA since 1974, when they first promulgated the Safe Drinking Water Act. And in 2006, we had a groundwater disinfection rule. Prior to 2006, groundwater was considered to be a pristine water product and not needing any kind of treatment, conversely to surface water, which is exposed to human recreation and stormwater runoff and things like that. So, but what we learned through years of monitoring is that groundwater is also susceptible to contamination with contaminants that can make you sick. And that's a concern because even private groundwater supplies, the owner of those private wells might assume that the water is clean because it's in the ground and the soil helps to filter out contaminants, which is true, but not 100% true. So we're very concerned too about making sure people with private groundwater supplies are aware of some of the vulnerabilities of their drinking water systems and the fact that EPA does not regulate their water because, again, it's a private water source. Now, another thing that's mandated by the EPA for public water utilities is that they produce a consumer confidence report. And what this report is that the consumers must be made aware of what contaminants have been monitored and found in their water supply. And so the consumer confidence report comes out at least once a year. It usually comes with your water bill, and it has information on what types of contaminants and at what levels were found in your water. And that's really important to know because then you can make decisions about if you want to treat the water to an additional level, maybe at the point of use at your own tap in your household, to provide further assurance that these contaminants are removed because they may be commonly found in your source water supply. The one thing about the consumer confidence report is a lot of people, when we survey, say they've never received this report, but it likely came with your water bill at least once a year, but maybe you didn't recognize it was an actual report because it kind of looks like an advertisement or just some kind of informational flyer that maybe people don't realize they need to read more closely. But it's a very important report that has great information about the quality and concerns related to your individual water supply. Now, when I'm talking about drinking water contaminants, what am I actually meaning? Well, there's a variety of categories. Again, microorganisms. Some of the illnesses that microbes in water cause are GI or gastrointestinal illness, aka diarrhea, hepatitis, pneumonia. Some of these infections can either be very mild and self-limiting or very serious and cause chronic long-term health effects. Some examples are parasites like Cryptosporidium and Giardia, bacteria like Legionella, and viruses that could be hepatitis virus or norovirus, rotavirus. And then we also have microbes in water that are sort of naturally present that we use as indicators of water quality. And HPC bacteria is one of those. It stands for heterotrophic plate count bacteria. So we monitor just this general level of bacteria in the water. And if the levels increase, then it may be because the water wasn't disinfected properly or treated properly in some other way, or it's sitting in a holding tank where it gets heated up and it grows to higher concentrations. And that can happen simultaneously with bacteria that can make you sick. So HPC and total coliforms is another category that we monitor for, are not necessarily health threats, but they do help us monitor the quality of the water. Then we have disinfection byproducts. You maybe have heard about some of these. This is when we disinfect the water and the disinfectant combines with natural contaminants in the water, like general organic matter, like leaf debris, dirt, things like that. We can get these byproducts that can actually have adverse health effects like cancer and nervous system problems. So some of these disinfection byproducts are bromates, chlorides, haloacetic acids, and trihalomethanes. And then there's the disinfectants that we add to the water, and they're very beneficial for killing the microorganisms, but there's a balance between their application, because if the levels are too high, they can have their own adverse health effects like eyes, eye, nose, and skin irritations, stomach issues, anemia, and other nervous system effects. So chlorine is probably the most common disinfectant that's used to treat drinking water, but we also use chloramines and chlorine dioxide. Inorganic chemicals are things that may come from industrial or mining waste runoff, fertilizer runoff into the environment, and even from natural erosion. Arsenic is an example of a contaminant that can be naturally present in our rock formations, and as rock and soil degrades, then arsenic can be released into the water supply. So it's a big concern also with groundwater supplies. But from some of our mining operations or other industrial operations, cadmium, chromium, copper, and lead can be released into the environment. And then nitrates often come from fertilizers that are used in farming operations. Now, all of these contaminants, when they get into the water and we're ingesting them, can cause liver and kidney damage, cancer, and developmental disorders. Organic chemicals, the largest category of organic chemicals that you would be familiar with are probably pesticides, but they also come from industrial waste as well. Things like benzene, dioxide, glyphosate, and polychlorinated biphenyls or PCBs are common organic chemicals that we're concerned about in drinking water supplies. And they can cause liver and kidney damage, cancer, and reproductive disorders. And when we look at chemical contamination of water, the CDC is responsible for tracking waterborne outbreaks and listing them and notifying people of when these outbreaks occur. The problem with this database is, especially with chemicals, is that they're only really looking for acute or immediate health effects. And so we've only documented about 105 actual acute chemical outbreaks since 1971, and that's been associated with about 5,000 cases of illness and 6 deaths. But health effects from chemical contaminants in water that we're most concerned about are those long-term effects like cancer. Health effects are not always immediate in terms of chemical exposures through your drinking water. But we have a number of emerging contaminant classes that we're really not sure what their health effects are. We're exposed to them probably from the beginning of your life as an infant. When you first start drinking water or drinking formula that was made with water, we're exposed to pharmacological active compounds in water that can cause disruption to your endocrine system. things like pesticides and even things that seem pretty innocuous like laundry detergents, fire retardants, and again, disinfectants. All of these things can have an effect on our biological systems. We're exposed to them continuously at low levels, but lots of different mixtures of chemicals throughout our lifetime. So we're really not sure about the long-term effects of these variety of chemicals that we're exposed to. What happens when you combine multiple chemicals? We tend to study the effects of single chemicals on biological systems, but what happens when you're exposed to hundreds, maybe even thousands of chemicals throughout your lifetime? What chronic exposures and chronic health outcomes might be occurring? A lot of unknown questions there. And then in terms of the microbes, we have two different kinds of microbial based infections that can occur. The waterborne infections, these are microbes that originate in fecal matter, and they generally are transmitted by ingestion of the water. Examples again, cryptosporidium, norovirus, and rotavirus. And then we have this category of water-based infections. These are microbes that are naturally present in the water. There was no contamination event that occurred. There's no waste or fecal matter getting into the water. These organisms already live there. And they're generally spread via direct contact, like to your skin, or through inhalation. And some examples here, probably the one you heard most of is Legionella, which can just grow in water systems that don't have chlorination, residual chlorination, or when the temperature of the water gets heated up, then Legionella can grow like crazy. Also, if the water sits stagnant for a period of time, that's a perfect condition for Legionella to grow. Pseudomonas causes a lot of problems in hospital water systems because, again, it's naturally present. It can grow in the pipe systems, and it can really attack people who are immunocompromised. And then Naegleria is a free-living amoeba, and that's an organism that can be found in water. It's not spread through ingestion or inhalation, but rather through forcible entry into the nose. So if you get water up the nose, then Naegleria, if it's present in the water, can cause a brain infection, and it's highly fatal. So the three general categories of microbes that we have in water tend to be viruses, bacteria, or parasites, which can include protozoa and amoeba. When we look at the outbreak database that the CDC has monitored over time since 1971, this is a period from 1971 to 2006. And I picked this period because in this time frame, about half of the waterborne outbreaks were not identified to be linked to any particular cause. So it had unknown etiology, we call it. So roughly 45% of the outbreaks that occurred, we didn't really know why during this time frame. Legionella appeared to cause a very small portion of the outbreaks during this period of time. So the CDC documented here about 841 outbreaks associated with over 500,000 illness cases, and it occurred pretty much ubiquitous throughout the United States. Over 41 states experienced outbreaks during this time frame. The interesting part is that few systems that experienced an outbreak had any type of violation to the regulatory standards. So outbreaks can still occur even though the HPC counts and the total coliforms and fecal coliform counts are being met through the monitoring system, because we don't monitor directly in the water supply typically for specific viruses or for Legionella or for specific parasites. We use these indicator systems to measure the quality of the water. If we look at the most recent survey period from the CDC that's been published, the most recent surveillance report was published in 2017. We're due for another one. They usually come out every couple of years, 2 to 3 years, but there hasn't been one since 2017 released. And that was for the survey period of 2013 to 2014. But look what's really interesting here. Now we don't have a big piece of unknown etiology. Rather, we've identified that Legionella is causing more than half of the waterborne outbreaks that were identified in this 2-year time frame. So in these 2 years, we had 42 outbreaks in 19 states, about 1,000 cases of illness, but 124 of those resulted in hospitalizations, and there were 13 deaths. And when we look at the causes of the outbreaks, Legionella in premise plumbing, so that's in the plumbing that's actually in households or in hospitals or hotels, that was the primary cause. So how do we focus on improving the quality of the water once it gets into our own pipes, because the EPA is no longer responsible for your water once it reaches the meter at your house. You are responsible for that water. And how are you treating that water at your tap that's gone through the premise plumbing? Now, if we look at all of this data holistically, since we started surveying and monitoring for waterborne outbreaks since 1971 up to the latest survey period of 2014, you can see that Legionella, which is the black boxes at the bottom of the column, really has been increasing. But some of that is because we started looking for it more. It may have been there. You see some black boxes previously. So some of that is retrospective studies where we've gone back to see, do we think Legionella was present and caused that outbreak? And so there's been a number of outbreaks throughout history, but none like we're seeing today. And in fact, 2014 was the worst year for waterborne disease outbreaks since 1983. So even though we've implemented a lot more regulation, we're discovering more potential vulnerabilities to our water supply that's causing outbreaks in the population. Now, this is some survey data that was published by a variety of researchers, so not necessarily by the municipal water utilities themselves, but water samples that were collected over time to evaluate contaminants that might be present. And so this is water that was treated and should be ready for consumption. And we still find positives in the drinking water supply for cryptosporidium. 27% of the water that was sampled still tested positive for cryptosporidium, even after it was treated. Helicobacter pylori, I haven't talked about this much yet, but this is an organism that is commonly found in water, even groundwater supplies, and it's been associated with being a primary cause of ulcers, stomach ulcers, that can also turn into stomach cancers. Naegleria fowleri, it's also known as the brain-eating amoeba. That's the organism that gets into your system through your nasal passage, forcible entry of water up the nose, and can infect the brain and cause very severe health outcomes. Most people who are identified as being infected with Naegleria actually die from that infection in a very short period of time, within days. Legionella, big problem in hospital water supplies. Up to 33% of hospital water systems test positive for Legionella, and 47% of public and private water taps testing positive. Mycobacterium is another water-based organism, naturally present, causes a lot of problems in immunocompromised populations, and very commonly found in the water supply. Now, if we look at groundwater contamination, and remember, this is a concern not just for utilities that are using groundwater as a source for drinking water supply, but also homeowners who have their own private wells. And you can see here how often groundwater systems have tested positive in research studies, up to 50% in the Midwest of wells that were tested, and 8% of 50 homeowner wells that were tested, testing positive for human viruses. So if we look at the true impact of waterborne disease, the CDC outbreak data is a little bit misleading because they just don't catch a lot of the disease that's occurring. For an outbreak to actually get documented, the CDC requires that the illness was diagnosed by a physician, and the physician reports it to the health department, and the health department reports it to the CDC, and then the CDC feels confident enough that the etiology was known and it was definitively linked to water, and then it makes it to the outbreak database. So that just doesn't occur very often. If you think about when you've become sick, do you ever really recognize, if you have diarrhea or the stomach flu, do you ever really recognize, hey, I think that might have come from my water, drinking my water. I'm going to go to the doctor and make sure this gets recorded. It just doesn't happen that often. But if we take some of the survey data of the finished water supplies that have tested positive for different organisms, and we know how much water people are drinking every day, up to 2 liters, then we can calculate how many cases of waterborne disease that we think is really happening. So I published this paper in 2008, which estimates that there's more like 19 million cases every year of disease that's occurring in the population. And then other colleagues of mine have evaluated not just from the survey data at the municipality, but the survey data after the water goes through the distribution system, and there's more opportunity for contamination. And they have found that the cases may be more like 24 million cases of waterborne disease occurring. So why are we missing some of this waterborne disease in our outbreak data? Well, we've talked about a reporting problem, but This red line is sort of the threshold that I'm exemplifying here of when the outbreak is large enough and investigated, likely to be investigated and recorded in the database. So over a period of time, very few events of water contamination and illness actually make it to the CDC database that exceed this red line threshold. But at the bottom here, where you see the dotted green line, this is where the green line represents our acceptable risk threshold. And so anything above that green line is a level of disease that we've decided we want to regulate to, we want to treat the water to, and we don't want to exceed. That's our acceptable risk threshold. But we often do exceed the threshold of acceptable risk, not always, but enough where we're not really meeting our acceptable risk threshold all the time. And if we look at the disease spectrum of waterborne pathogens, we're familiar with diarrhea causing a lot of waterborne disease, and we're not too afraid of diarrhea in this country. We can treat it, and it's usually self-limiting and through good nutrition and rehydration. But there's a wide array of other health effects that we know occur through exposure to waterborne viruses and even chemical exposures, as we've mentioned previously. Another health outcome that is suspected from exposure to some viruses is obesity. There's actually a virus called adenovirus 36 that is linked to obesity. We think it turns on fat-producing enzymes in the human body and can actually make people gain weight. Now, how does our water get contaminated? Well, we have things like this that can occur where there are sewage main breaks. And so this is raw sewage just existing in the environment. There are likely water pipes that run through this environment as well, serving the houses that you see in the background. But when you have main breaks, then you have potential mixing and cross-contamination of sewage with the drinking water supplies. We also have what's called confined animal feeding operations. So you see here a large population of chickens, which are producing a large amount of waste. And this waste has to be stored in the environment. And sometimes the waste can contaminate groundwater supplies or leach into surface water supplies as well. And this happens readily if there's flooding events. So this is a picture of a hog farm in North Carolina where there's been flooding, and the waste from the hog farm and other stormwater runoff waste went into the local surface water source supply, which was the nearby watershed, just behind the edge of those trees in the upper right corner. So climate change is a problem in terms of water quality and drinking water quality distribution. We know that 50% or more of documented waterborne outbreaks were preceded by an extreme precipitation event. And in this picture here, you see tropical hurricanes. And as climate change continues to occur, we see dry areas getting drier and wet areas getting wetter, and stormwater runoff is a big problem for water contamination. So combined sewer overflows is one example, and we've kind of phased these out in modern day, but there's still a number of older regions that still have combined sewer overflows. So what this means is that when it rains, the rainwater runoff is collected and it goes to the local wastewater municipality to be treated. But sometimes if there's heavy rain or heavy snow melt, it can overrun the capacity of the wastewater treatment system. And so anything that overruns the treatment system just runs back into the environment. And so this is a concern with about 860 municipalities in the United States that serve more than 40 million people where this contamination could be occurring. And everywhere you see a black dot is where there has been a recorded combined sewer overflow for this particular year. So combined sewer overflow can result in large volumes of untreated sewage waste going into the environment every year. So the US EPA estimates about 1.2 trillion gallons of sewage and stormwater are released into the environment every year in the US. And just to put it in perspective, this is enough of a volume to keep Niagara Falls roaring for about 18 days. That's a lot of sewage. Another condition we have that's more common actually is sanitary sewer overflows. So, most communities are collecting their sewage. We have over 500,000 miles of sewer pipes in the United States, and sometimes they can get blocked and they can back up and then they can leak back into the environment. And that's what you're seeing here in some of these pictures. The EPA estimates that anywhere between 23,000 and 75,000 sanitary sewer overflows occur each year in the US. And this is a map of just a single year of documented events of this occurring. Now, one of the studies that I worked on, and this was a Water Quality Research Foundation funded study, we wanted to look at how many boil water notices were being released in a 2-year time period. And so this was a survey of over 155,000 US public water systems that were reporting. There's about 160,000 total public water systems serving drinking water to the public in the United States. But a boil water notice occurs when there's been a break in the system that was identified, or a known microbial contamination, or a low pressure event that might cause some back siphonage of contaminants from the external environment into the plumbing of the distribution system. And so if this occurs and it gets documented, then the utility is required to issue within 48 hours a boil water notice saying that the public should not consume the water unless they boil it, because there could be microbial contamination that could make them sick. So 53% of boil water notices were issued because of a known or identified main break or leak. And this is a concern because when your distribution pipes break, then we know contaminants can enter into the system. So when we look at the US distribution system, we know that in that 2013-2014 most recent survey period, it caused 64% of the drinking water contamination, or it was responsible for the outbreak contamination. And so when we look at our pipes, why are these high levels of breaks occurring? Well, we know that the average life expectancy of our pipes in the US is about 75 to 120 years, but the average replacement rate is about every 200 years. So there's a disconnect there. We know that there's about 25 to 30 main breaks for every 100 miles of drinking water distribution piping in the United States, and that's equivalent to about 237,000 breaks per year that do occur. So we have water pipes below the water table, so there's definitely a chance for intrusion events for contaminants to get into the pipes. And then when power outages occur, we get this negative pressure draw that can further draw contaminants into the distribution system. And we know about 10 to 20% of water that's been produced by the utilities is unaccounted for at the taps. So that means the water is leaking out because it's not going to be evaporating from the pipes. So these are all issues for why we have some concern about our drinking water distribution system. The other system that we should be concerned about is what I've mentioned previously, and that's premise plumbing. So that's the plumbing within your house, your distribution system plumbing. The EPA is not responsible for that. But this was a great study that was done at the University of Arizona back in 2004, looking for HPC bacteria. This is not bacteria that is a health concern, but it is an indicator of what's happening in the water system in terms of bacteria being able to regrow. So this was done in my area in Tucson, Arizona. And so the groundwater supply was tested at the municipality and found to have very low levels of HPC bacteria present, 1 to 10 colony forming units. But once the water went through the distribution system, we saw about a 10-fold increase in the bacteria. So as the water heats up, or it picks up more bacteria throughout the distribution system, maybe from biofilms, then we know that there was an increase in HPC bacterial counts. But look what happened once the water got to the household tap. We saw about 1,000-fold increase in bacterial concentrations. And the way this happens is because in your own home plumbing, your water can just sit stagnant, and that's a condition where bacteria can grow, and also a condition where chlorine residuals from the disinfection step from the municipality may be dissipating, and you can just get bacteria naturally growing. So bacteria that are naturally present in the system will also grow, like Legionella, Mycobacterium avium, and Helicobacter pylori. So premise plumbing is a big concern in the cause of drinking water outbreaks. I mentioned Naegleria previously. Naegleria is a brain-eating amoeba, and we always associated Naegleria with people swimming in stagnant water supplies. But in October of 2013, the CDC confirmed that Naegleria can actually be present and spread through municipal drinking water. And not through drinking, but through sort of some unconventional exposures. One example was a 4-year-old boy who was playing on a slip and slide, and so water was forced up the nose and he got a Naegleria infection. So likely the source was from a hose, but that hose was a tap water outlet at a household level. And then in my state of Arizona, we had 2 5-year-old boys get a Naegleria infection from kind of swimming in the bathtub. It was a jacuzzi bathtub. They were trying to breathe from the air jets underwater, water forced in the nose, and a Naegleria infection, and also a pool water exposure where the pool was being filled from a hose. It was not yet treated, but the the boy was swimming in the pool and got the infection. So when we started looking at household taps to see, can we find Naegleria? It was very easy to find. And luckily, infections are very rare. There's only been 133 infections in the US since we started looking for it and up to 2014. But only 3 people have survived those infections. So extremely high mortality rate, a very scary infection, and an organism that we know can be present in tap water. And we do know we find them in refrigerator filters. So we do know that filtration at the tap can remove this amoeba from the water supply. Now, in the future, what are going to be additional sources of emerging pathogens? We're still going to be seeing issues in our water supply, and new issues are popping up all the time. So humans ourselves are sources of contamination, and we will continue to be as we continue to produce waste, as will animals. But some of the microbes are getting very smart. They're developing new environmental reservoirs where they have stages of their life cycle that they're very well adapted to survive in the environment. We're going to be recognizing new pathogens, but also existing pathogens. Pathogens will continue to evolve and adapt and even genetically change. And we're going to continue to see greater impacts than we currently realize. So let's talk a little bit about water treatment. There are solutions to some of the problems that we find in drinking water contamination and control, but water treatment is really a multi-barrier approach. So your municipality is really responsible for the first 3 bullet items here. They're responsible to protect the source water from contamination from wastewater or stormwater runoff, making sure the source water stays protected. And then at the treatment plant, they're responsible for treating the water. And this is done through steps like coagulation, sedimentation, filtration, disinfection. And then they're responsible for securely delivering that water to you through the municipal distribution system. And usually they'll add a mild chlorine residual to help the water stay clean throughout that distribution. But what we know and what we've been talking about is we have drinking water outbreaks that still occur. The water treatment system is not 100% reliable. The distribution system is vulnerable to breaks and leakages and intrusion events that can occur that would overtax the mild chlorine residual that is found in the water. So I'm a big proponent of point of use and point of entry water treatment. This is where you have a system in your home that can further treat the water and guard against any contamination that might have happened before you actually consume the water. And realize some of that contamination is not the fault of the municipality or what happens in the environment or industries that are polluting the environment, but some of that happens in your own premise plumbing where the water can sit stagnant and bacteria can grow. What is point of use and point of entry water treatment? Well, point of use systems and point of entry systems are installed at the household level. Point of use systems are installed at the drinking water tap or at the actual shower head, and point of entry systems are treatment systems installed at the household water inlet, so outside of the house, and it treats all of the water coming into the house. What are their primary effects? Well, they can remove harmful contaminants, they can soften and condition your water, and they can improve the aesthetics of your water, make your water look better, taste better, and smell better. So we call them a final barrier to consumption. They provide additional protection from what's happening in the municipality, the distribution system, or the premise plumbing before it gets to you. And so it really adds an additional standard or advanced treatment technology, adds that availability for you to utilize that for filtration of the water. And some common methodologies are reverse osmosis or carbon filters, and you can even disinfect the water at another step using commonly ozone or UV light. When we think about the evolution of waterborne disease, in the early 1800s, we have these massive epidemics and into the 1900s, but we had the development of treatment plants during the 1900s where that stopped the big epidemics like cholera and dysentery. But we live today still with this endemic level of disease that can really have a major impact on our vulnerable populations, our immunocompromised populations, which can result in serious illness and even death in these populations. But even for people who don't die from this exposure and level of disease, can experience this chronic sequela of illness that impacts our quality of life, associated with chronic illnesses, even things like diabetes or arthritis or irritable bowel syndrome can be associated with waterborne contaminants. And there's a cost burden that we've realized associated with these exposures. So point of entry and point of use devices, this is where we can have some impact for reducing the endemic level of illness in our society. Point of use filter benefits have been documented through research, and some of these are from Water Quality Research Foundation funded studies in my laboratory. If you see some of the asterisks under cost beneficial studies, but if we look at the top of this list, point of use devices have been found to reduce waterborne outbreak frequency and intensity. And so in this one study, diarrheal disease was reduced by 50% with households that had reverse osmosis treated tap water versus households that had no treatment at the point of use, that were just consuming the tap water. And children really gain the most by having a POU system in place. Studies have shown a 17% disease reduction in children that have RO systems, and rather than just drinking the tap water directly. And especially very young children, 2 to 5 years of age, they're the most immunocompromised, and we see 40% more infections from tap water. Now, a lot of these infections are mild stomach ailments, stomach flu, diarrhea, but a 40% reduction in illness that this study found is very significant. We've also seen that POU devices significantly reduce the incidence of legionellosis from Legionella exposure in hospitals, where 28% of tap water tested positive versus no samples testing positive with point of use devices. And point of use devices are highly cost beneficial. The study that we did that was WQRF funded found that in the US, that if everyone was given or purchased a point of use device, that would cost throughout the US about $17 billion. But what we're already paying in responding to a waterborne disease burden from microbes is more like $24 billion. So it's cost beneficial to treat our water to a higher level at the point of use. And then we also had an event in Flint, Michigan with lead exposure. I think many of us have heard about this. It made the news quite a bit, but this was an event in 2014 where the municipal water supply switched their actual source water, which was a more corrosive water, resulted in lead leaching from the distribution system and premise plumbing into the water supply. And the lead levels tested at these households range from 25 parts per billion to up to 13,000 parts per billion. And the action level for the EPA, where you're supposed to treat the water to remove lead or to stop the corrosion, have corrosion control, is 15 parts per billion. So dramatically exceeded in Flint, Michigan. And in our study, we found for that particular community, at the average concentration of lead that the community was exposed to, had they had a point of use device in place for that community, they would have saved $424 million. So POU devices are cost effective. And then they also are effective at reducing or removing emerging contaminants that are not currently being monitored for or necessarily controlled by the wastewater municipalities, or that we're not meeting the acceptable risk standards. So things like PFAS contaminants, lead, arsenic, other endocrine disrupting compounds, adenovirus 36, that's the obesity virus, Legionella, and Cryptosporidium. So when we look at lead, we've heard a lot about lead exposure since Flint. A lot of people have been monitoring lead at schools and in hospitals and finding that we're exposed to lead at very high levels throughout the United States. So this map shows areas where 18 million people, we believe, on community water supplies are drinking water from community water supplies that are in violation of the lead and copper rule. And you can see that map here. And the darker areas represent greater concentrations, where the darkest areas are where a million people are being served in those particular regions. So regionally, some of us are being exposed to a very high level of lead. Similarly, when we look at the distribution of arsenic throughout the United States, and keep in mind that there is no safe level of arsenic, but it's naturally present, so it's difficult to control from a municipal water treatment standpoint. But concentrations exceeding 10 micrograms per liter have been associated with lung and bladder cancers. And in one study where 7,000 private wells were tested, over 50% of them tested positive for arsenic. So arsenic could be a very big concern, especially for private water supplies. But point of use devices properly designed for arsenic removal can remove up to 99% of the arsenic. So looking at this question of is water in the US safe for public consumption, we've defined safe from a regulatory perspective. We've said that our acceptable risk limits are a probability of 1 in 10,000 infections per person per year for microbes and a probability of cancer at a level of 1 in a million per person in a lifetime. And when we look at is our water meeting acceptable risk standards, we don't think so. If we even look conservatively at 9 million infections occurring in a population of 319 million people in the US, we have a less than a 1 in 10,000 infection risk occurring. Or sorry, a greater than a 1 in 10,000. We have about a 1 or a 6 in 100 infection risk occurring. And then when we look at cancer risks, certainly are being exceeded for certain contaminants like arsenic and lead, and in some areas where you've seen in the maps where people are much more likely to be exposed at levels higher than acceptable standards. So protection from water quality uncertainties, this is where POU and POE final barrier protections can be very beneficial, whether you are on a municipal or a private water source. And aesthetically, POU and POE devices can really improve the taste of your water and also protect you from these health threats. But what you need to make sure is that you're using a certified system. Make sure your system has a label like one of the ones listed here on the right, where there's been independent verification that whatever the product is claiming to do, it's actually doing, and that they're using safe materials to do it. And note what the contaminant reduction claims are. If you need a system that treats arsenic in a targeted way, then make sure that's the system you're selecting. But many systems have multiple stages of treatment, and so they can treat microbes and arsenic and lead and multiple things at the same time. But it's also very important that once you install a system at the household level, that you use it properly and maintain it following the manufacturer instructions. Make sure you're changing your filters at the recommended frequency and maintaining your system so it provides quality water for you. And I thank you very much for listening to this webinar. This was sponsored by the Water Quality Research Foundation and produced by my laboratory, the Environment Exposure Science and Risk Assessment Center at the University of Arizona, and in cooperation with the Western Region Public Health Training Center.